Ursula, yes.
But it's not called Ursula.
No, my name is Ursula. If we are doing it again, we are with him.
Uncle?
Please, I'm happy.
Have you been in a situation where your child becomes suddenly sick and you take the child to the hospital? You stay there for about 4 hours. Nobody has attended to you. You are watching your child deteriorating. All you see in the emergency room is 3 nurses running around, attending to so many people at the same time, too busy to be approached. You say to yourself, no, I have to do something. If I keep staying here, I'm going to lose my baby. You go to another hospital. On getting there, the situation becomes worse because all in sight is just only 2 nurses and they are too busy to be approached. By the time you think you want to know what next to do, your 9-year-old baby dies in your hands and that's your only child. How do you feel? That is devastating. That is why I'm here this evening to talk about effects of nursing shortage in the United States. My name is Ursula Nze. I'm here this evening to tell you the effects of nursing shortage in the United States, the possible solution to it, the causes, and I will start by letting you know what it means so that we'll be able to understand better what we're discussing. The Center for Nursing Advocacy 2008 described nursing shortage as dangerous widespread shortage of nurses needed to take care of sick patients and the population at large. Goody in 2003, according to Goody in 2003, a few points were mentioned as the possible causes of nursing shortage. One is decline in the choice of nursing as a career. New people were not coming into the profession. Aging of RN. The aged nurses left the profession when they retired. There was a massive exodus of retired nurses, the baby boomers, who retired between the year 2005 and 2010, left a great hole in the nursing profession, and that caused the shortage. This new demand in nursing profession, the trend and issues in nursing, that's what they call it, that brings into technology that nurses have to deal with the patients and deal with the technology. It made a lot of people leave the profession out of fear of making mistakes. Poor nursing image. People see nurses as people who are nasty and unorganized, and nobody wants to choose nursing as a career. These are the few points that they mention as possible causes of nursing shortage. Having known the cause of nursing shortage, let us look at the effects of nursing shortage. And looking at the effects of nursing shortage, Goody in 2003 noted that there is wide shortage of nurses that are jeopardizing healthcare system. These few points include poor hospital staffing. Hospitals are not able to get enough nurses to take care of their sick patients, and this made a whole workload on RN, that is high patient to nurse ratio. Nurses have more patients to take care of than they were supposed to. If a nurse is supposed to take care of patients, 4 patients, they went up to 10 patients at a time, and that brought about poor patient outcome. There are frequent medication errors. There is untimely delivery of care. Somebody is supposed to get medication at 10 o'clock. It doesn't get it until after 12. There's high poor patient satisfaction. There's high morbidity rate, morbidity and mortality rate. People develop pressure sores in the hospital. People die because they don't get the adequate care they needed. There is occupational injury on the side of the nurses, because these nurses, Collins et al. 2010 noticed that sometime in the ER a nurse slumped and they found out that she had full bladder and empty stomach. She has been running for 12 hours, no break, no lunch, not even to empty her bladder. So far we have seen the effects, the dangerous effects of nursing shortage. Now let us look at the possible solution. The government has tried at different levels to stop this problem, but they were all temporary. Now, Cooling et al. 2010 recommended some solution to it. One is recruitment of nurses. Nurses need to recruit more nurses. There are so many nurses out there who do not have a job because of fear of getting into the hospital because of overwhelming nature of the job of the nurses. International recruitment. The government needs to be lenient on immigration laws so as to bring foreign nurses into the country to come and help out. Continuous education. Nurses like to have continuous education. This will improve their image, improve their life, and make them comparable to other professions outside if they improve their education. And then improving the nursing image by lightening their workload and making them make them work in a safer environment. All this can help to improve nursing shortage. To crown it all, we look at nursing shortage. The possible effects of nursing shortage. We looked at the causes of nursing shortage, and we looked at the solution to nursing shortage. Now, we have to, before we leave, we have to note that the government needs to, we have to know that there's a general concern that nursing shortage is jeopardizing healthcare quality in the United States, and the government has to do something by funding recruitment of nurses and improvement of nursing work area so as to bring a check to the effects of nursing shortage. Thank you.